So with those logistics out of the way, I'll move on with introducing our two presenters. Our first presenter, Kathleen Navarro, works for the United States Forest Service on the Manti-La Sal National Forest. She has evaluated wildfire smoke exposure for the public and wildland firefighters through direct monitoring at wildfires. Kathleen completed her PhD in the Environmental Health Sciences at UC Berkeley School of Public Health, where she also completed her Master's in Public Health degree in 2011. Her dissertation combined traditional methods of exposure assessment with new approaches to evaluate exposures in ambient, community, and occupational settings to air contaminants commonly emitted from wildfires. She has a Bachelor of Science degree in Environmental Toxicology from UC Davis. Our second presenter, Megan Martinez, is a Zone Fuels AFMO on the Custer-Gallatin National Forest. She has worked in fire and fuels at the field level for the U.S. Forest Service and National Park Service for almost 20 years. And Megan will be providing some more information on her background and experience during her second presentation. So Kathleen is going to start us off, and I'll hand this over to you, Kathleen. Thank you for so much for being here today, and go ahead and begin whenever you are ready.
Thank you for having me, and I'm excited to get this information out to as many people as possible right now. So I'll be talking about a project that I did with people within the U.S. Forest Service and some academic researchers as well, titled Wildland Firefighter Smoke Exposure and Risk of Lung Cancer and Cardiovascular Disease Mortality. So smoke from wildland fire can emit many different types of air contaminants, and these contaminants are emitted through the pre-ignition phase and all the way into the ash and smoldering phase of fire. So the constituents of smoke that can be emitted are volatile organic compounds, VOCs, polycyclic aromatic hydrocarbons, PAHs, and I'll talk a little bit more about those later, nitrogen oxides, particulate matter, and carbon monoxide and carbon dioxide as well. So for this project, we focused on exposure to particulate matter, and these are small, fine dust particles that are out in the air, smaller than a human hair, and the way that they're measured is through the size of their aerodynamic diameter. So commonly, when we're talking about community exposure to smoke, we're really looking at that PM 2.5 level. So particulate matter that's measured at 2.5 microns. Additionally, for occupational exposure, we're talking about particles that are in that 4 micron size range. So size is important for these particles. The size really determines where these particles are going to get into your body. So the smaller particles are small enough to get through your airway, through your throat, and down into your lungs, and really into that lower lung alveolar region. And in that region is where we really have the transfer of these particles into your bloodstream, and then they move systemically throughout their body. So the smaller the particle, really the more toxic effects are we seeing. So some of the concern about wildland fire smoke and firefighters really came about in the 1988 Yellowstone wildfires. So these fires over the course of a summer resulted in 30,000 medical visits, 12,000 included respiratory complaints, and 600 required subsequent medical attention. And this is what really started, the concern of smoke in wildland firefighters. So in 2018, over 27,000 wildland firefighters were out, deployed to wildfires over the course of a summer. We all know they work in arduous work conditions, working, a 16 in California, they work a 24-hour shift. So you have this long duration for possibility of exposure to smoke and to fire. Their personal protection equipment includes no type of respiratory protection. And, this is really difficult because firefighters work at that arduous level, and having adequate respiratory protection, there really isn't a respirator designed that's really made to work in this environment and protect against carbon monoxide and volatile organic compounds, as well as that particulate matter. In addition, firefighters also have some concerns for off-duty exposures as well. So oftentimes in fire camps, you're in these valleys where you can get an inversion, and the smoke will kind of just sock you in over the night. So not only can you be exposed out on the line when you're fighting these fires, but there's an opportunity to be exposed when you're in these fire camps as well, which really can contribute to kind of a 24-hour constant, up to, a 14-day assignment, all through being exposed. So some short-term health effects from smoke include eye irritation, upper respiratory irritation, headache, nausea, and a decrease in lung function. Potential long-term effects, and this is really coming from the literature that we have looking at particulate matter exposure from communities and other exposed population, is chronic obstructive pulmonary disease, COPD, bronchitis, emphysema, heart disease, and different types of cancer. So some previous work that's been done looking at exposure of particulate matter and carbon monoxide in wildland firefighters have found an increase in inflammation markers, which really kind of leads to other health complications. So inflammation markers are more of kind of an intermediate step, along a chain of adverse health effects that can occur. We also have seen a decrease in lung function. And then one study done out of the University of Montana really tried to look at what are the long-term health impacts of wildland firefighting. So they sent out surveys to wildland firefighters and looked at the years of wildland firefighting and how they associated with self-reported health outcomes. So from that, they found a significant increase in high blood pressure, an increase in heart arrhythmia, and an increase in having knee surgery, which at first to me seemed very surprising, but then after I got out on fires myself and put on a heavy pack on a very steep slope, that made a lot of sense to me. Additionally, firefighters have been looked at to look at their pre-season, post-season health effects and have found an increase in airway response, a decrease in lung function, and some increases in additionally those inflammation markers as well, and an increase in upper and lower respiratory symptom scores. So some of the other exposure work that I've done out on fires is looking at those polycyclic aromatic hydrocarbons. So this is some work that I published a few years ago, and this is looking at a PAH naphthalene, and this is known to cause some types of cancer. And looking at that across different job tasks, we found that people performing holding, and then also looking at staging and patrols job tasks as well, had higher exposures of this chemical. And then looking at fire camp exposures, I went out to a fire in California over the course of 12 days and looked at nighttime and daytime exposures and found that, during the day, there were higher PM 2.5 concentrations being reported by some monitors, and this is due to increased fire activity than at night. So, at nighttime, you're still having these exposures, and this the picture in the background is where we were at fire camp. So you could get that inversion at night, and then during some firing operations at night, you could also see the spikes in PAHs. So then looking at how fire camps compare to different types of wildfire exposures, we see that they're really kind of in line with what I was able to measure out on prescribed fires. And so, there's still that opportunity for exposure at fire camps. And then looking at wildfire exposures, they're much higher. So recently, looking at the National Wildfire Coordinating Group 10-year fatality report, we're also seeing that heart attacks are now the leading cause of death for wildland firefighters. So this has bumped above vehicle and aircraft accidents. So the objective of this study was to estimate lifetime risk of lung cancer and cardiovascular disease from relative exposure to particulate matter, so that PM from smoke. And so how do we assess risk? So within environmental health and public health, the way that we assess risk is through really a mathematical relationship. So this is comparing the dose of a chemical, so how much chemical is out in the air, out in the environment, and then how much we ingest into our body per day. And then we are able to look at the responses. So this type of curve, called a dose response curve, is generally developed using animal models in a lab. So you'll dose an animal at a certain amount and then look at what their health effects are across that. So you have a percent, 25% of your population gets cancer, or 50 or 75 at these corresponding doses. So the way that we were able to do this study is by utilizing a dose response curve that was developed by some researchers actually here in Utah at the university. And what they did was they aggregated particulate matter exposure health studies. So looking at what is in our ambient community environment, what are people exposed to in secondhand smoke, and then what cigarette smokers are exposed to, and then looking at their risk of development of lung cancer and cardiovascular disease. So we utilized this mathematical relationship to estimate our risks for wildland firefighters. So using this relationship, we were able to calculate a dose for wildland firefighters and then estimate the relative risk of lung cancer and cardiovascular disease. And the way that we calculated dose was looking at the exposure concentration, so how much PM is in smoke in the wildland environment, and this was done through field studies, which I'll talk about next. Then we looked at wildland firefighter specific breathing rate, so how much air, the liters of air, are they taking in per minute? And then looking at their total shift duration as well, and then able to calculate how much particulate matter in milligrams is someone exposed to out on a line on an average day. So this exposure work is based off of work that's been done through the Technology and Development Program for the U.S. Forest Service by George Broyles and Joe Dimitrovich, looking at what people are exposed to out on fires. So they were able to get about a sample of 80 particulate matter exposures and then 411 carbon monoxide exposure days as well. So this was done through direct monitoring of wildland firefighters. So firefighters were asked to wear, relatively small pieces of air sampling equipment. So on the left, you have a cyclone that's attached to a quartz filter, and then that is attached through tubing to the middle, which is a sampling pump. So the sampling pump will draw air through the cyclone and it will attach to the filters, and then we're able to see what the concentration of particulate matter is in the air over the course of a day. And then they were also asked to wear some real-time carbon monoxide sensors as well. So this study looked at firefighters that were performing many different types of tasks out on wildland fires. So fire line construction, looking at swampers and sawyers and diggers, looking at holding, which is often considered a very smoke intensive task, looking at mop up, which additionally can be exposed to, that smoldering smoke as well as the ash out there. And then engine operators, they not only can be exposed to smoke, but also the diesel exhaust as well that's coming off of the pumps and the trucks, and then people performing firing operations as well. So these firefighters were followed throughout the day in 15-minute increments and recorded not only what they were doing, but what their fire environment was like too. So what were the flame lengths, what was the wind doing, and some work that Megan will go through is talking about what those fire environment variables meant for exposure. So just briefly looking at what firefighters were exposed to during this study, they found that for the measurements of particulate matter, 22% of participants were above an occupational exposure limit. And this occupational exposure limit was developed by people at NWCG to really account for the fact that firefighters do not work a typical 8-hour day that the OSHA, Occupational Safety and Health Administration recommended levels are. So putting that into this exposure response curve, we're really seeing that wildland firefighter exposure is in that lower part of the curve where communities and secondhand smoke exposure is occurring. So one assumption we had to use for this project was that the PM 2.5 that was aggregated by the Pope curve was similar to the PM 4, or the occupational size that we measure for, was equivalent. So generally we see in fire studies that under lab conditions that fire really is in that smaller than PM 2.5 size range. So we felt comfortable moving forward with this analysis in that assumption. So then moving to the second part of the equation, the breathing rates for wildland firefighters, we used some work that was done, again, by Joe Dimitrovich and Joe Saul at T&D, looking at field measurements of heart rate. So firefighters were asked to wear heart rate monitors while they performed a variety of job tasks. Then we used this heart rate and a relationship, a quantitative relationship developed by Valley et al., and estimated breathing rate from heart rate, and came to a breathing rate of 24 liters per minute, which generally, compared to other occupations that we measure for breathing rate, this seemed to be on the lower side, which you wouldn't expect at first. But if you think about it, firefighters are highly trained, highly physically conditioned, so they do have lower breathing rates when they are working at that arduous level. So again, putting that together with a shift duration, which we had about 13 hours per day, that exposure concentration that we measured out in the environment, and then the breathing rate that we estimated from field data as well, we're putting that together to calculate our dose. So we have our concentration, our breathing rate, our shift duration, and then what we had to do for frequency of exposure. So estimating kind of over a career lifetime, what are the fire days per year? How long would your career duration be? We then we got to our final calculation of daily dose. So the fire days per year is based on kind of what we assume to be a short season and a long season. So the short season is based on a 500-hour overtime season, and a long season is based on a firefighter working a 1,000-hour overtime season. And then we varied the career duration between 5 and 25 years. So putting that all together and looking across career duration, we were then able to calculate excess risk. So for a short season firefighter who's worked a 5-year career, we calculated that there will be an excess risk of lung cancer of 8% and a 16% excess risk of cardiovascular disease over a firefighter's lifetime. And then moving all the way up to the long season firefighter who's working a 25-year career, which is really kind of equivalent to possibly your hotshot superintendent, they have an excess risk of lung cancer of 43% and an excess risk of cardiovascular disease at 30%. So going through the limitations of this study, we did have some assumptions that went into our dose calculation. We weren't able to really look at, how precise our estimates were, and we didn't account for any kind of prescribed fire or fire camp exposure as well. But that is something that I'd like to try and work into these calculations in the future. So wrapping up, we found that firefighters have an increased risk of developing lung cancer and cardiovascular disease. And as you would expect, risk increases with fire days and career length. So future analysis, including that prescribed fire exposure, but also looking at management personnel as well out in fire camps. Not only are they exposed possibly earlier in their career out on the line, but now they're in those management roles as well. And then looking at kind of cumulative risk. So we just looked at PM exposure, but we really need to be looking at the whole chemical composition of smoke to better estimate risk as well. So Megan will be talking about some mitigation strategies in her presentation, but I just kind of wanted to briefly go through what we've recommended. And when we're talking about occupational health, we have these hierarchy of controls and how we mitigate for adverse health effects. So we're not going to be able to eliminate smoke. We're not going to be able to remove the physical hazard. There's no substitution. Engineering controls, such as placing ventilation out there, is highly unlikely. And currently, we really don't have good PPE options. So really what we're left with are administrative controls and thinking about how to change the way people work. So these include mopping up, only to secure the line, not having kind of an arbitrary mop-up standard of going 500 feet in, 300 feet in, for holding, rotating crews in and out of smoky areas, and then training, really working on having your first year firefighter know that smoke is a hazard, and I think getting people to think about small personal ways that they can reduce their exposure may mean something for their lifetime risk of these diseases. So I just wanted to say thank you to the Joint Fire Science Program for the funding support, and Megan and I will be taking questions at the end of the webinar.
Good morning. I'm Megan Martinez. I am a Fuels AFMO on the Custer Gallatin National Forest. And before I get into the goals of my presentation, I want to tell you a little bit more about myself. I started working for the Forest Service on a hand crew on the Tahoe in 1998 when I was 19. And I spent 10 years as a seasonal on fire crews, mostly in the West. And this is my 9th year working in fuels for the Forest Service. I used to mostly do operations. Now I do more prescribed fire. And I'm working on becoming an air resource advisor, which I will say more about later in the presentation. So when I first started, I didn't think about the health effects or performance effects of smoke and particulate matter inhalation. I didn't get any information about it, and it really just didn't occur to me. I did used to say that fighting fire would be easy if it weren't for the smoke. Back when I was in excellent physical condition, I figured this is just manual labor, except that the smoke gives me a headache and makes it hard to breathe and burns my eyes and makes it hard to think. But I didn't think of that really much as something other than just an inconvenience. So I really didn't get any information about smoke and particulate matter until I took RX 410, which is the prescribed fire smoke management class. And I took that class about my 12th fire season. And at that point, I went up to one of the instructors and I said, "It sounds like smoke's really bad for you." And he said, "Yeah, but that's why you take these mitigations." And I said, "No, we don't take those medications, at least not in my experience." And so that got me on the track of wondering what I could do to improve things. So I will say I'm not a researcher. I have no academic background in the health effects of smoke. I don't speak on behalf of any agency or organization. And what I say here is not all inclusive. I'm really just interested in communication and leadership and the application of research to the field. So here, the title of my presentation, Smoke and Particulate Matter Mitigation for Wildland Fire Professionals. I'm using that term to recognize that, right, some of the tasks we do are not just fighting fire, but the people who inhale the most smoke and particulate matter are the fire line folks. And so generally speaking, the goals of my presentation are to share information to help fire personnel, safety officers, and fire decision makers to understand the importance of addressing smoke and particulate matter inhalation, as well as challenges, successes, and actions related to reducing exposure. I will say that these field-based successes and challenges are my experience and that of coworkers I've talked to, not some broad-based survey. As far as the additional resources go, in the interest of time, I can't go into them extensively, but I numbered them, and where I quote them or use an idea pretty directly, you'll see a number on the slide that matches which resource I'm referring to. So who's at risk? While not everyone has the same sensitivity to wildfire smoke, it's still a good idea to avoid breathing smoke if you can help it. And when smoke is heavy, such as can occur in close proximity to a wildfire, it's bad for everyone. So that point there, it is worse for some people, but it is bad for everyone. And that is from this airnow.gov, which I list later. Comes from the Environmental Protection Agency. Kat went into this, but there are potential short-term and long-term effects. I have experienced all of the short-term effects, including headache, fatigue, nausea, respiratory distress, impaired judgment, and eye, nose, and throat irritation. Long-term effects, which have not been well studied, include cardiovascular or pulmonary conditions, as Kat mentioned, and potentially other cancers. Some of the components of smoke are known carcinogens, and others are suspected carcinogens. So before I go any further, I want to talk a little bit about the reality of fire. I do get that there will be fires, and that fires are smoky and ashy and dirty, and that neither the public nor fire personnel can avoid smoke altogether. So what we're talking about is finding ways to mitigate it. And so I want to tell a quick story that was kind of a turning point for me. I had inhaled lots of smoke prior to this story, and I've inhaled lots since. But in about 2012, I was on a project fire in Northern California. I took a crew out, and this fire had lots of dozer line on it. And the dozer line was really dusty. And so we were spending lots of time walking on it, working on it. We also got an assignment to hold for a burn operation. And during that burn operation, I got just an awful headache. And, I knew that I couldn't leave the crew since I was the crew boss, and also that I wasn't going to complain because I just didn't complain. And so I don't know if it was that night or shortly thereafter, I got a bloody nose that was gushing pretty good for like an hour, which was atypical for me. Again, I didn't tell anyone, not going to complain. And then when I left the fire, I was waking up in the middle of the night coughing multiple times, waking my husband up, really not sleeping well. And 8 or 10 days later, after getting off the first fire, I got the opportunity to go on a single resource assignment up to Idaho. And so I took off on my 700-mile journey, and I was super tired. Within the first 100 miles, I was falling asleep at the wheel. And this story doesn't end that dramatically. I didn't crash. But that series of events really got me thinking more about whether there were ways to mitigate exposure. Now, you'll notice I didn't say anything about how my crew was doing because I wasn't really thinking about it. At the time, it didn't occur to me to wonder, could we get some dust abatement on the lines we were walking? I probably told them to walk in a straight line behind me, tight spacing. As far as the holding goes, I think I told them to hold their area versus maybe doing some more patrolling and getting out of the smoke. So looking back on that, wondering ways that I could do a better job as a leader too. So I'm going to read from the recommendations of Kat's research that she just referenced, which is mirrored pretty closely in another resource I'll refer to. For the past 25 years, many researchers have made recommendations to wildland fire management agencies to minimize exposure. Many of these recommendations are consistent across all studies. Minimize mop-up, develop a medical surveillance program, develop wildland fire-specific operational exposure limits, train firefighters on smoke hazards, and reduce exposure by limiting shift length and rotate crews out of heavy smoke areas. Based on the findings from this project, there has been no appreciable reduction in firefighter exposure, and in some instances, unsafe exposures are more severe than observed by previous research. So this is a little longer than the course of my career, and seeing that this isn't changing, I wondered how I could help. So there are some real benefits of reducing smoke and particulate matter inhalation. These top two, it's a key component of risk management, including improved situational awareness and safety and improved performance. And better long-term health outcomes is explained better. I'm going back to those same two documents, recommendations. Exposure to wildland smoke has direct consequences on the ability of firefighters to remain safe by compromising their ability to think clearly and function at their highest mental and physical level. Exposure to the harmful constituents in wildland smoke underlies virtually every aspect of risk management and must be addressed effectively in order to assure other risk management decisions are sound. So I think that makes a pretty good case for it, but I also included a couple points there at the bottom. The last two are my opinion. I think that it's really a matter of respect to provide personnel with accurate information so that they can take reasonable mitigations. And I think that it's an important piece of the wildfire management conundrum. Managing wildfires is hard. There are lots of aspects to it, many of which are not that easy to predict or control. And this is one that needs to be considered. I think it's really an important factor in the short and long-term risk/benefit of our choices. So next I'll move on to some other recent and ongoing research or publications that address this issue, in particular in regard to fire personnel exposure. So a Google search reveals numerous governmental, academic, media sources And so here I'm going to list a few websites that are geared toward the public, although I will say that we can fairly assume that some of these websites have information relevant to fireline personnel as well. So the top one's from the Environmental Protection Agency, the second from the Center for Disease Control, and the third is that airnow.gov website that I quoted, which is also Environmental Protection Agency. So here's some more that are more specific to wildland fire. Kat was referring to number 6, which is actually a 3-part study. Number 4 is a really good all-around document. Number 5 as well. All of these have information about things like operational exposure limits, smoke and particulate matter, tasks that expose personnel to the most smoke and particulate matter, as well as recommended mitigation measures. And I really recommend that folks look through this when they have some time. The bottom 2, I think it's more likely that fire personnel have seen, the 6 Minutes for Safety and the WFSTAR 2014. I will say I didn't run across these in the course of my job. I came across all of these documents by seeking them out. And I think that we can really improve on that and get people some of this info more directly. So here's some additional and ongoing research. The top one is a very recent publication, Factors Affecting Smoke and Crystalline Silica Exposure Among Wildland Firefighters. Number 10, increased carbon monoxide clearance during exercise in humans, which has a finding that I will refer to later in this presentation. And then number 11 is an ongoing study, acute, subacute, and chronic effects from wildland firefighting, which includes the National Institute for Occupational Safety and Health, the Park Service, and the Forest Service are studying wildland firefighters over the course of 3 consecutive fire seasons, focusing on cardiovascular and respiratory health as well as other health outcomes. So next I'm going to move on to my experience with field-based successes and challenges. Again, this is my experience and that of folks I've worked with over the years, not a comprehensive survey. That said, the recent smoke and crystalline silica exposure paper I just referred to, the authors state that they, quote, are not aware of research by any land management agency into the frequency of deployment and situational effectiveness of smoke exposure mitigation strategies. So there's not much data on what folks are doing and how well it's working. So challenges. I would say that the number one challenge in my mind is the dissemination of accurate information. Over the course of my career, I've heard things that unfortunately aren't true. I wish that they were. That vegetation smoke isn't bad for you because it's just vegetation. So for one thing, it is bad for you. And for another thing, right, if you're downwind of a WUI fire, you are inhaling other smoke components as well. I've been told that when I blow my nose and cough, I expel all particulate matter. Wish that was true, but isn't. I used to hear that using a bandana would protect my airway adequately. Also wish that was true. And so I think that getting more accurate information out there is important. I've also heard outside groups come to conclusions that wildland firefighters are a self-selected group. We know exactly what risk we're taking and we're choosing to take it. And that could be much closer to the truth, given that there is a lack of research on long-term effects. It really can't be true that we are making entirely educated decisions. So next, I'll say indifference. So I said, right, as far as I was concerned, I just wasn't. It just didn't occur to me for kind of an embarrassingly long time. There are also folks who assume it's bad for them and they just don't care. And as far as that goes, I would say that, we really need to get people information. And if they wind up indifferent, as long as they're not preventing other people from getting the information and taking reasonable mitigations. So the long-term effects are abstract and the short-term effects are normalized. What I mean by that is, I think it's kind of human nature to have a hard time grasping things that are only possible and are occurring in the future. Certainly for me as a young person, that was true. Also, what does an early lung cancer diagnosis look like, or a heart attack? If we're not relating it to our work, and right, it's not as obvious as, say, a tree strike or a burn over. Short-term effects are normalized. What I mean by that is you learn pretty quickly that some of the work is going to be uncomfortable or worse than uncomfortable, but you're not going to complain about it. And I would say that some of the short-term effects are also kind of abstract, right? I mean, how does it look when someone is now too tired and too muddled to drive? How does it look, some of this decision making? So I think that those are both challenges. That moves me on to culture. So the one piece of mitigation info that I've gotten over the course of my career is that people sometimes say, rotate out of the smoke if you need to. And believing that to be a question about my comfort or about my toughness, rather than about my health or performance or decision making, I never rotated out of the smoke. No one else was doing it, and I didn't need to do anything that other people weren't doing. So that's a cultural issue that might have some improvements. There are other things that I've done, like, chunking piles that have plastic on them while they're still billowing smoke. I can be kind of a compulsive pile chunker. And, I guess that's hard work and, working hard 100% of the time. But those are probably simple changes that we could make. So no complete or easy fix. I think that is a challenge because there are lots of hazards, and it's tempting to focus on ones that have easier solutions. Bureaucracy, how that's affected me is it hasn't been clear to me who in the organization has the authority to address this. Now, that said, it's probably fair to say there are people higher in the organization who would also like to address this, who also don't know how they would do it. Barrier to doing job. This one I would describe as the biggest risk of addressing smoke and particulate matter exposure. So I've heard this a few ways. There's the practical aspect of, for people who are trying to maximize their hours, it doesn't sound that great to be told that they should reduce their shift length. Another portion of that is more tactical. So to the extent that you believe your job to be to suppress fires as quickly as possible, which sometimes meets the greater public good or natural resource management objectives, it doesn't sound that great to be told to back off. So increased pressure of holding prescribed fire. I am a moderate complexity burn boss, and I will say I do want people to hold line and to catch spot fires and to mop up to the extent necessary. And prescribed fire is a tricky one. We do see high exposures during prescribed fire tasks. But during my briefing, and I've recently changed this, I'm now saying those things I do want you to hold, but if there's not a reason for you to hold or stand or work or rest in the smoke, don't. And there's another portion I'll describe in my briefing on the next slide. So with this and everything else, I do want to hear what else. I'm always open to the likelihood that I don't have all of the information. So there are some successes. I have seen and heard of some field supervisors addressing this. There has tended to be an increase of big box strategies in recent years and decreasing the amount of mop-up, which is sometimes intended for other purposes like fire behavior or snag hazards, but has the same effect. Some folks include this info in briefings, going back to my prescribed fire briefing. Another piece of info that I got is from that increased carbon monoxide clearance during exercise in humans. So a researcher I contacted referenced that paper to advise that we should make sure firefighters are moving around when they are holding line in areas of smoke to promote clearance of carbon monoxide in blood. I would say presumably in areas where there is cleaner air, but that's a key point that I didn't know for a long time, that your body is clearing carbon monoxide much better when you're moving around than stationary. Tactics, timing, and firing patterns. I know some folks, do manage to address this, including things like reducing the mop up. Someone gave an example of holding a burn operation with sprinklers, which, took them a while to set up, but then deciding what is worth the extra effort. And I think that that calculation has to come from better communication about what the risks are of smoke and particulate matter inhalation. Timing, so aiming for fuel moistures and weather conditions that lead to more complete combustion, so there is less ongoing smoldering and smoke. Especially I look for that in prescribed fire opportunities. I think a lot of folks do pretty well with firing patterns that favor wind direction and dispersion. I know it can be tricky, but it's worth trying to find better opportunities. I have seen examples of pretty simple burns where we weren't putting much effort into the firing pattern, but many folks do address it. Line selection and planning. So I'll speak to prescribed fire first. I do really try now, all the way from the NEPA level, to get lines that are easier to hold. So rather than saying we can hold this mid-slope line, we plan to get all the way to the ridge line or all the way to the area that has fewer fuels, either in the burn side or the green side. So I know that there is some of this happening on wildfires as well, although I do realize that it can be more time compressed. I know that some supervisors really try to get their folks spiked out in clean air, and that there are sometimes clean air trailers brought into camps. As far as that spike out piece goes, I do realize with terrain and atmospheric conditions, you might have to go a long, long ways, but it's worth looking for those opportunities. The worst carbon monoxide exposure I've had was a prescribed burn where we were camped. It was a remote area. We were camped adjacent to the burn. Now, I'm not saying this stuff is all easy, but it's worth shooting for. So I would consider the completed and ongoing research to be a success, especially to the extent that we get this information out there. Going back to air resource advisors, I said I'm becoming one. So the Air Resource Advisor position is a technical specialist that's relatively recent, and they are intended at a minimum to provide information to the public about how to mitigate smoke. So doing things like deploying sensors and providing smoke forecasts so the public knows what are the better times of day to do activities and whether they should be doing outdoor activities at all. Now, some Air Resource Advisors also provide information to teams about fire line personnel mitigations. And from what I've been told, some management teams are all about it. There was recently Senate Bill 47, which passed, and it formalizes the Interagency Wildland Fire Air Quality Response Program, which I think means that we will be seeing more Air Resource Advisors, at least on the big project fires. Some outreach resources are tackling this. I definitely have seen things in Wildfire Today and the Wildfire Lessons Learned Center, for example. So last slide. What can you do about it? And I do really want to hear from folks in the audience and people in general. What do you think you can do about it? I will offer this. Take action at the field level. I do think that at some point the government or regulatory agencies will address this, whether by choice or because they're compelled to. But in the meantime, I think that there are actions that we can take to improve things without a top-down mandate. So I'm going to read one more time from the paper CAT used and the similar 2013 paper. In their recommendations, they say every wildland firefighter must understand the risk associated with smoke exposure and learn how to reduce exposure. Training also must be given to agency administrators and incident management team members who make decisions that affect the exposure to firefighters. Suppression response and mop-up guidelines need to be made that are consistent with operational needs and firefighter safety. Otherwise, risk is being transferred to firefighters rather than being shared with all, including the incident commander, agency administrators, and the public. So I think, those are good points. We could put information in our low-level classes by just deciding to do it locally. We could go after simple changes in the field by just deciding to do it locally. I think that there are tasks that safety officers and agency administrators could take on. Safety officers maybe could be providing handouts and asking how mitigations might reasonably be applied. I think agency administrators could be more specific about making this part of their planning and risk management. I do have some specific messages and questions that I could recommend, but I know that many of you might have ideas that work as well or better than mine, and that there are people who are influenced by you who aren't influenced by me. I do think that the messenger and the messaging are important, and that this is worth talking about and trying to improve. So with that, I think I'm turning it back over to Megan for questions and comments. Are you there, Megan?
Yep, thanks, Megan. And thank you to both of you, Kathleen and Megan, for the really informative presentation and for sharing your personal experiences and your research with us today. We really appreciate it. And we'll open it up for questions now while we wait for people to get a chance to submit some questions, which you can do by typing them into the chat or question pane on your webinar control panel. I will quickly mention an upcoming webinar that may be of interest to attendees to this webinar. On June 4th, we'll be hosting the webinar Assessing Wildland Firefighter Sleep and Fatigue While on Fire Assignment, which will be presented by Dr. Randy Brooks from the University of Idaho. So the registration page for that webinar should be up on our site within the next week or so. So do check back for that. Okay, so it looks like we have some questions that are coming in and have come in, so I'll get right to those. First, what is the impact to those firefighters that were exposed to the Yellowstone fire back in the 80s? Was there follow-up?
As far as I'm aware, there was no follow-up to any of the people who required any kind of medical attention, but it did really start the conversation of, how do we track these and how do we measure these? So some work was done into putting together proposals for a medical surveillance program that was not funded.
Great, thanks, Kathleen. Next question. I have found prescribed fire to be a much higher concentration of smoke exposure than wildland fire, but the study, I think referring to your talk, Kathleen, shows the opposite. Is that correct?
I wouldn't say that exposures, the literature also says that to be true, that prescribed fire exposures can be higher for firefighters than wildland fire. It's just that for our study, we weren't able to really get a good sense of the fire days per year and the amount of time spent on prescribed fire to estimate that dose. So that's some numbers that we're trying to work to get at so that we can add that into that risk estimation.
Great, thank you. And I have another couple coming in, but sorry about the screen switch there. Just want to be able to see the full questions. So next question is, In wildfire studies for exposure, does sampling include sampling the source to understand the potential max of PM that potential exposure can be, and why?
Studies have not looked at that. That is something that I've been trying to think about as well, is, how much smoke is out there in the environment versus how much we're putting into our bodies. But I did try and do that in some work that looked at the 2013 rim fire in Yosemite and took concentrations and emissions of PM 2.5 and then estimated that for community impacts of smoke.
Okay, great. I'm sorry, everyone, for the screen changes. I'm having issues with the question pane. So I'm just going to leave it like that. All right, we have time for a few more. What about exposures of aerial firefighting personnel, for example, pilots?
We haven't looked at pilots specifically, but I do think that there is a risk for exposure. Even if you have maybe a perception that there's clean air out there, there's still those risks exist, and that opportunity for exposure as well. And as we expand and try and study more of these exposures in personnel, I think that's a really important role to look at as well.
Great, thanks, Kathleen. With the increased exposure in the wildland urban interface to more chemicals and smoke, examples given are house, car, agricultural fires, have there been any studies on this type of exposure in wildland firefighters?
There has been a little bit of preliminary work actually done in California through the Cal Recycle program. They have done some sampling post-fire in those urban interface areas as they were developing a hazardous waste protocol for the cleanup after those fires as well. And there's some work being done by some University of California researchers as well, really trying to look at those exposures. And I think they're of great concern as well, because not only are you having this smoke, but if you have firefighters sifting through this dust that can contain asbestos, heavy metals, and some of those polycyclic aromatic hydrocarbons, they are of great toxicity and risk.
Great, thanks, Kathleen. Let's see. We have a lot of questions coming in, so I'm trying to make sure we get represent the variety. Is there current research being done on PPE options?
I believe there is, but I don't really have the specifics of that. There has been a call, out there to the respirator companies to develop a wildland specific respirator. I believe that work's being done by NFPA.
Okay. Let's see. What are your thoughts on the use of hot shields with the particulate filters built in? If you have any experience in those areas.
I don't have any experience with the hot shields, but I will look into it.
I don't have any experience with that either. I haven't heard of it.
Okay, thanks, Megan. We have a comment here, RX 410 is outdated and needs a rewrite. Has anyone heard talk of this happening?
I don't know that I would get any information outside of Region 1 where I work, but I have not heard of it here.
Okay, great. Let's see, let's fit in a couple more. We do have a lot in there, and just so the two of you know, there are a lot of comments. Very appreciative of the information provided as I'm scrolling through these. Great information. Are there studies that are tracking the impact to the surrounding community members and health issues? And the second part of that question, does this information lend itself to better forest management to mitigate risk and more aggression associated with putting out fires more quickly?
There are, some case studies that have looked at community level exposure to smoke and then health impacts, really looking at kind of that hospitalization data. And one study that came out recently looked at the community of Seeley Lake after the Rice Ridge fire and found that they're still having some health effects even, 1 year and then 2 years after the fire, which is really the first study that is kind of over a period of moving into the future tracked community health effects as well. But I think one thing is, we're going to have fire on the landscape, and everyone is going to be exposed. So I think it's also community members thinking about, where is that risk being transferred to? If you want your fires put out more aggressively and more suppression to be done, your firefighters may be more exposed.
I will chime in just to say if that person or people with similar questions are interested in a conversation about landscape management and suppression response, I'm not an official authority on it, but I have lots of things I'm happy to share.
Great. Yes, and so we won't be able to get to all these questions, so I don't forget to mention this. Both Kathleen and Megan's contact information is on the slide that's currently up, and they were both willing and hoping for additional contacts or questions if anyone has those. And my contact information is also up on that slide. Let's try to fit in one last one. And our SO and MEDU leaders coached or trained to monitor firefighter crews for smoke. Is it on their to-do list?
I don't know those acronyms. Can you say them again?
I don't either. They're SO and MEDU. So if you're not familiar,
Yeah, sorry. SO
no,
to me is supervisor's office.
right. Well, let's go to one more. Is there any insight on what makes people more sensitive to smoke than others? Can your body get better at dealing with smoke over time?
I'm not sure there's any information on how our bodies adapt to smoke, but if we think about it from an exposure and health, route, the more that we expose our body to chemicals, the harder it is to clear those and can really have some dysfunction within our immune system as well.
Great. Thank you so much again to both of you for taking these additional questions and being open to providing your contact information. That's about all the time we have today. As attendees close the webinar, a brief survey will pop up, and we really would appreciate and value your feedback and input on opportunities for improvement and also potential future webinar topics you may be interested in. If you have any more questions regarding this webinar or have requests for future webinars, feel free to email or call me at any time. Again, my contact information is up on the slide right now and can be found at our website and our firescience.org. I want to thank everyone for your participation and engagement with our topic today, and thank you again to Kathleen and Megan for taking the time to share your research and work with us. We really appreciate it. And with that, thanks again, and I hope everyone has a great rest of their day.